Okay, my name is Celeste Lopez, and I chose the Japanese language and specifics to stuttering for my final presentation. So, beginning with the Japanese language, or also known as Nihongo in Japan, there are 126 million native speakers, and it's the ninth most spoken language in the world. So, the Japanese language was influenced by the Dutch, European, and Chinese languages. Moving into the field, the actual field of speech-language pathology was established in 1956 in Japan, whereas in the United States it was established in 1925, so a 31-year difference. What I found interesting was that in the United States we have ASHA, which was established in 1925, where in Japan they established their own called the Japanese Association of Speech Language Hearing Therapists, and that was created in 2000, so a 75-year difference, which you will see later on how that kind of correlates to maybe the limited amount of resources and research pertain to the Japanese field. Going into the requirements, starting off with the United States, we have our high school degree, bachelor's, master's, pass the praxis, complete your CFY, and once receiving your C's and licensure, have continuous education. Whereas in Japan, you have a choice of 3 options. So 4 years of training after high school, 3 years of training after high school, or 2 years of training after 4 years of college courses / credits, which I found pretty interesting just because their requirements aren't as strict and comprehensive as the United States. You would assume that there would be more practicing SOPs, but actually there are very limited amount of SOPs compared to the United States. So I found that pretty interesting to keep in note. Moving into the evaluation process or receiving a diagnosis. So in Japan, in order to receive a diagnosis or treatment for stuttering in specific, you actually have to go to your primary care physician within the medical setting. So you would have to get diagnosed by an ENT, neurologist, or a pediatrician. But I found it interesting because the actual evaluation process is carried out by a speech language hearing therapist, which is what they determine, is actually what they call it in Japan rather than an SLP. So I found that pretty interesting because here in the United States, you could be evaluated in a wide range of clinical settings, one being the school. Another thing that I found interesting is that approximately 75% of the speech language therapists work in the medical hospital setting, whereas only 5% actually work in the school. So I found that pretty interesting compared to the United States. I found that a lot of speech therapists work in the school setting, and in Japan it was more of the medical setting. So that's a good comparison for you. So since limited resources and research available, I actually came across a stutter talk, and it kind of talked about the stuttering characteristics. So within the stutter talk, the actual host was Karen Herring, which is a person who stutters, and she received her PhD. And we have the interviewee being Kode Noguchi, and he actually is receiving, I think he wants to go into his doctorates, but he is a current CF SLP as well. He actually talked about his experience growing up in Japan, and it was pretty cool that through their conversation of the stutter talk, they came across the characteristics, and they both verbally agreed that the primary characteristics such as whole word repetitions, interjections, prolongations, and blocks were pretty much the same in both Japan and the United States, but they agreed that in Japan, the secondary characteristics were not as common, and you rarely saw anyone in Japan portray those secondary characteristics. So I found that pretty interesting because here in the United States and in courses that we've taken and in books that we've read and projects, we are pretty known to take into consideration this secondary characteristics. Moving into stuttering assessments. This was one thing that was really tough to find research on. So moving into the first stuttering assessment tool and the only stuttering assessment tool in Japan, it's called the Stuttering Test, and it was developed in 1981. So the usage has been pretty limited, and it's really only given to a small number of experts or professionals because it was designed for research purposes only. So you can see how that's kind of complex and difficult to actually give a stuttering diagnosis. And then the other one, which was adapted from the United States, was the OASIS, so the overall assessment of speakers' experience of stuttering. Though they have a pediatric and adult version, the Japanese decided only to adapt the adult version. So, and they of course use this as their reliable and valid instrument to determine how their stutter impacts those adults. So, on a quick note before I move forward, I just want to state that in Japan, it is rarely given, you are rarely given a diagnosis as a stutterer or a person who stutters as a pediatric individual. So usually in Japan, if it does not affect your daily life and you are not working, you are not in that field of giving back to others, you do not need to work on your stutter. So usually it is only required to work on treatment, most cases as an adult. But of course, some individuals do receive treatment, which we'll move into the next slide, as a kid. I just want to make that note. Now moving into the treatment, like I said, preschool children, if they receive a stuttering diagnosis, they will work on an indirect treatment, including your parents. Older children, such as adolescents, will receive more of a direct treatment, including both the parents and the clinician, while adults, that's whenever we include the integrated approach which combines the fluency shaping, stuttering modification, and reducing those negative feelings towards your stutter. Okay. So one thing, kind of in a way going back to that stutter talk, they introduced the word wa, which is what they classify their Japanese culture to be. So wa in relation to English translates to harmony. So in Japan, they believe that each individual and their culture in general has a harmony. So everyone is looked at as the same, and they all need to be the same in order to keep that harmony alive and standing strong. So if you have a communication, fluency, language difference, you in ways disrupt that harmony, and you aren't looked upon as an equal. You are in ways looked at inferior. So most cases, people who stutter are usually hide from society, whereas in the United States, the person who was doing the stutter talk said that in the United States, they are more seen as an equal, just with a difference, or that their stutter is part of their communication process. So I found that pretty interesting. Another thing mentioned in the stutter talk, but I'm going to talk about now, is that in Japan, presenting your feelings is actually something that's difficult to practice in Japan and their culture. So which can make it difficult for treatment, which could make it difficult for asking for services, because it is kind of in ways looked down on to express how you're feeling to another individual. So cons related to the population. So cons that I saw were some limited resources, of course, sparse, limited SOPs in Japan, and poor fluency research. The special populations that I chose for this presentation was selective mutism, which is a disorder characterized by persistent failure to speak in certain social situations due to extreme anxiety. So it tends to be slightly more common in girls than boys, and it's a rare disorder similar to stuttering, and it affects less than 1% of the population. So instead of verbally communicating, the children with selective mutism often communicate with gestures, nodding, and nowadays AAC devices. So similarities between the two is that both are involuntary speech issues that affect the communication aspects, And in ways, they both can relate to shyness, fear of social embarrassment, and also social isolation. Of course, others, but those are the three that I found the most known to speak about. Overall, I would assume that if someone who has a extreme severe fluency diagnosis can eventually maybe pick up selective mutism and include it into their daily routine a little bit more, just because of the shame, fear, embarrassment, isolation that they may feel, and they may just kind of compensate with selective mutism rather than speaking out how they're feeling with their actual stutter. Overall, here are my references that I chose and went through for my presentation. If you have any questions or concerns or anything that you would like to ask me about my presentation, please feel free to put it in the discussion, and I'll be glad to answer as best as I can and give you any references or resources that I found. Thank you.